behind, so I'm going to call an audible and provide some of those SEAL program updates first. You probably all saw this go out regarding the Human Resources building. The offices there are moving over to the Bright House building, which is on Riverside Drive at 1516. So the Organizational Development Department, Taylor's office and Human Resources, Employee Relations, all of that will be over there. They do have shuttles running back and forth, so that's the plan for that. We are moving on, I think, the week of the 8th and the 15th. It's kind of in phases. Is that right, Kayla? When are you guys moving? Is it the 8th? Okay. The date has changed a few times, but so expect that coming. We, as discussed in some of the previous meetings, are looking for a way to kind of reimagine the SEAL new hire lunch. We're actually meeting with the powers that be later this week to kind of finalize some things with that. But we want to keep that instituted in some fashion so that you could still, if not during the orientation time, maybe get meal vouchers to take your new hires for your departments to lunch or coffee or anything else for that. So look for more news about that. I want to note that there was a scheduling conflict with Probasco way into the month of March. For any of those who may have been scheduled for the second March meeting on the Friday, you probably saw a calendar update on that. That is still happening, so it was originally scheduled for like this third week of March, but that meeting is now on the 15th. If you're scheduled for the Wednesday meeting, that's still the same. So that was updated in the EOL, so it'll all reflect it there. I sent out a message just yesterday regarding the survey extension. Thank you so much to all the folks who have provided feedback on that thus far. We have got, I think, maybe about half, and which, 50% is a decent response rate for a big group like this. But we do want to give you guys, if you haven't had a chance to respond to that, a chance to go in and share your feedback. We definitely appreciate it. And we'll be digesting that in the next couple of weeks and either report that back out through email or maybe have a chance to break it down during our next meeting next month. So. There was one of the things that popped up in the SEAL survey. There were quite a lot of comments regarding huddles and the frequency with which people are able to hold them, and kind of folks kind of reaching out for ideas about how to better conduct huddles in their departments. So what we put together was a quick job aid that you probably saw as you came through. Definitely pick one of those up. There's just some quick tips on how to kind of carry out an effective huddle, and some of that information actually came from some of the feedback. We had asked how you guys are promoting team engagement, so I included some of that in there as well. I don't know to what extent you folks maybe discussed huddles when the certification process was going on. That was maybe before I got here at Erlanger, but definitely hang on to that and maybe try to utilize some of those tools in your huddles there in your department. I reached out to the folks at McCarthy who are doing the construction for the new children's outpatient clinic and have arranged some dates to get some of you guys over there to take a tour if you're so interested. I think the max is 20. I'll have to double check. And I'll send out information about those dates. Probably won't be until October that we can get over there, but look for that if you're interested. It'll be first come, first serve. We won't be able to accommodate all of the SEALs, but with 3 dates, that should get us about 60 folks the chance to get over there and check it out. And the last thing I wanted to mention, for the organizational development team, we have a new member who will also be helping to coordinate the SEAL program. Amanda Johnson-Prano has joined us, so you might see her around, also receiving maybe some communications in the future from her, but we're glad to have her aboard, and she's a great addition to the SEAL support team. So I see that Greg is here and getting hooked up in the back. I will turn it over to him. After Greg, I think Kayla's going to step up and tell us a little bit about Thrive Health Fair, and then later on we will have Elizabeth Appling from the diversity team come speak with us about the cultural sensitivity training here. So Greg, are you all hooked up there?
Yes, I believe I am.
Excellent.
Thank you. How's everyone today? I've been off campus, and so I'm running a few minutes late, and I apologize for that. So give you a quick update on a few items, and then let's have a Q&A session. But I'll start by this. I'm out of dress code. What's wrong?
Name tag.
No name badge. I took it off because I had a meeting off campus. So I took my badge off, and I'm running late, so I ran straight in here instead of go back by my office and put it on. So I do apologize because I should be in dress code. I should be setting a good example. And I'm failing to do that at this this moment. But anyway, you quickly noticed. So I decided I'm going to lift it up because somebody's going to say he doesn't have his badge on, and he should. So just a few quick updates as far as where we are and some activity that will be taking place between here and December 31st. Year-end ended June 30th, and accounting in the finance department takes about 60 to 90 days to complete year-end close. So they go through, they work with the external auditors, and they close our books to determine did we do well or did we not do as well as we wanted to as from a fiscal perspective, from a profit and loss statement perspective. So they're in the throes of conducting those reviews, working through that process, working with the external auditors, and that should be complete in the upcoming few days. There is a Budget and Finance Committee meeting, I believe it's October the 1st, and the numbers will go public at that October 1st Budget and Finance Committee meeting. So that's when all employees and the public will be notified of how our year-end ended from a profit and loss perspective. But what I'd say to you is this, because it was a tough year from a profit and loss perspective this past 12 months, meaning the year ending June 30th. If you think about it, Epic. So we budgeted for Epic. We knew Epic would be challenging for the organization in implementing it from an inpatient perspective in November. And you felt that challenge. I feel quite confident in making that statement. You felt that challenge. And what we realized is even though we had multi-millions of dollars designated for training for Epic, it still was not enough. And so we faced a decision. Do we continue to expense above and beyond what we budgeted for training around Epic, or do we not? And if we didn't, obviously that complicates, the learning process. It complicates caring for the patients. It's not the right thing to do. But short term, it would have led to more profitability or more revenue in excess of expenses for the fiscal year 18. We made the decision not to. We expensed money above and beyond what we had budgeted for Epic training. And where did we get that money? We decreased the profitability of the overall organization. So what I would say to you is this. Don't know what the year end is going to look like, but we do know just from an Epic perspective, and it's not Epic the product, it's the training and assimilating people so that they can most effectively use Epic. We spent more money than we had budgeted. We anticipated a lot. We worked with Epic. We worked with information technology specialists in determining what those budgeted dollars needed to look like, but we still fell short. And so that is taking from the bottom line, you may say, from the profitability of Erlanger Health System. So that's one. I just want you to keep that in mind as we move forward. But that will roll out October 1st. I'm looking forward to hearing about our profit and loss statement just as you are. As far as fiscal 19 is concerned, the budget has been approved by the board. The bottom line, the bottom line is $15.5 million. That's not just from net income from operations, but the bottom line is $15.5 million. Last year, fiscal 18, we budgeted $5 million. So we did go up 3 times from $5 million budget to a $15.5 million budget for fiscal year 19. And you may say, well, how did you do that? How did you go from a budgeted $5 million in fiscal 18 to a budgeted $15.5 million in fiscal 19? And really, it's a couple of things taking place. In a profit and loss statement, you have revenues and you have expenses, as you well are aware. So that makes up the $15.5 million, how those net against each other. And on the revenue side, we worked with all the hospital CEOs. We worked with the service line AVPs, the service line leadership teams to determine how we could grow our business. And part of being able to budget the $15.5 million was working with the managers and the leadership, those that have responsibility for growing our business, and what they viewed we could accomplish in this 12 months from a growth in the business perspective. It may be orthopedics, it may be cardiovascular, it may be urology, it may be children's hospital, whatever it may be. We worked with the leadership team and projected growth. So we are projecting growth this year, and so that is fed into building that $15.5 million. And a couple of other things from an expense perspective that I would say. We don't have the Epic training. I know there's still dollars being expensed from an Epic perspective and around Epic, but it's not as substantive as we spent in fiscal year 18. So we do not have that expense we're having to fund this particular year. Additionally, and you've probably remember hearing this along the journey of implementing Epic, we we were running duplicate systems until June 30th of 2018. There's still duplicity, but we're not have the full expense of 2 systems. So that's just a couple of expenses that we're able to pull out so that the revenues will run through the expense category and drop to the bottom line. So that's just in a very high level, how we can move from 5 to 15.5 million. And what I'd say to you, if Britt Tabor, and many of you may know Britt, he is our Chief Financial Officer, he could speak about this for hours. So I'm really simplifying it and maybe oversimplifying it, but I just want you to know a lot of thought, and it was very meaningful discussion that we had moving from a fiscal year 18 $5 million budget to a 15.5 million fiscal year 19 budget. We believe we can accomplish it. It's stretched. It's going to be hard. It's going to be challenging, but we believe that we collectively as an organization, you and all of our colleagues will be able to achieve that. As far as what's happening from a new service opening perspective, there may be a numerous things going on through the organization, but the ones that are highlighted, you know about these, but I'll just reemphasize that we're on course to open the services out at Erlanger East, the Comprehensive Cancer Center, the Breast Center, and physician practices in the Erlanger East Hospital campus and the new complex. I don't know if you've ridden by the new facility recently. It doesn't look exactly like the hospital, but they tried to construct it so there's a nice blend. You might say, you may or may not agree, from an architectural perspective and the color brick they chose, et cetera, but attempted to do that. And so that will be coming online here in the very, very near future. I believe it's expected to come online maybe by the end of October. I can't recall the exact date, but that will be a big opening for us. Additionally, the Children's Outpatient Center, all of you have, I imagine, have ridden by it in the last 30 days, and you see just how beautiful the facility is. And the fire truck is here, the wrecker is here, the fire engine or the locomotive is here. So it's really starting to shape up, and I think it's going to differentiate us as far as a children's outpatient center. Now, it's definitely world class. Will it be the best, in the world? I don't know, but I will say Bruce Kaminsky, who has really been the lead for us on that project, he has built, I believe, 20, 21, 22 hospitals that had great influence and about 20 children's hospitals and outpatient centers. So he is leading that for us. He's quite creative in his approach and what he's able to pull together from a community and kind of visioning perspective. So we believe the outpatient center is going to help differentiate us and definitely serve, first of all, the patients and the family members better than what they're currently being served, just from a facility perspective and a comfort perspective. And I don't know about as importantly as serving the consumer, but definitely very important. It's going to provide a much more effective and efficient workplace. So the individuals that provide the care, the clinicians, and those other individuals that are interacting with the family and patients, it is going to be much more functional than the current space that those individuals are working in. So we believe it's a win-win all around. And you may recall, the outpatient center in and of itself doesn't necessarily generate additional revenue for the organization. This is about working our way to having a new children's hospital, providing the venue, the facilities for both the patients, the families, and the individuals that treat that patient population, having them in a facility that we can all feel comfortable with and believe in and have pride in what I believe is a world-class facility. So those are two. We continue to speak to how do we expand orthopedics, how do we expand cardiology among a number of service lines. And what I'd also suggest to you that is something that's going to change to a certain extent about Erlanger Health System. We've grown over the last 5.5 years from $625 million to a $1.1 billion net revenue organization. That's what we're budgeted for in fiscal 19. So starting July 1, 12 months, run $1.1 billion. And we've done that without acquiring other organizations until fiscal 18. We did an acquisition, as you know, Murphy Medical Center. And Murphy Medical Center, and I'm just rounding numbers, they're not exact, it's $50 to $60 million of net revenue, somewhere in that range, probably 400 to 500 employees. So we're assimilating Murphy into the organization now. Some of you, I don't know if there's any Murphy employees in the room, don't know if some of you have been to Murphy. It's a beautiful community. It's someplace you may want to visit along your journey, at least go by at some point in time. But we grew that $60 million by acquisition. Now, you probably are aware we did not have to pay for the hospital, which is the best price you can possibly acquire new assets. I don't know that we'll ever get that deal again, but that's the deal with Murphy Medical Center. And we do have some commitments to the community because they, in essence, gave us the hospital. But with that in mind, we've grown organically. We've just grown by more orthopedics, more cardiology, more urology, more pediatrics, whatever it may be. And so I refer to that as organic growth. It's not by buying, new facilities or facilities that are up for sale. I think going forward, you will see a little bit of that tenor change. And instead of just growing organically, we will continue to look at our geographic footprint. Let's say Chattanooga plus 100 miles. Don't hold me to the plus 100 miles, but Chattanooga plus 75, Chattanooga plus 100. And you will see that, over the course of the upcoming 3 to 5 years, I'm not saying that we're going to be a 50 hospital system. That is not at all the message that I'm attempting to send. But I feel confident in saying we will continuously be reviewing organizations, other hospitals, and our healthcare facilities and potentially acquiring them as we move forward. So you will see there will be another Murphy. Will it be free of charge? Unlikely. But we will be very strategic in our thinking, look at our footprint, look at our landscape, Chattanooga plus 100 miles, and say where do we need to be and how can we best serve those patients and how can we strategically position Erlanger so it can sustain itself over the course of many, many years. So the message is we probably will do more Murphy deals as we move forward, and that will be part of our growth strategy. And again, is it 1 a year, 2 a year? I'm not certain. And I'm not talking about going out and purchasing, a hospital for $500 million. These would probably be, smaller organizations, smaller hospitals. We just have to review it, do the analysis and the analytics behind it and determine if it's right for Erlanger, our mission, the patient population, and does it help promote kind of continuum of care from patients moving throughout that Chattanooga plus 100 miles. So it would be with a lot of intentionality. What questions do you have?
We've talked a lot about East. Is there any consideration for what we might be doing over at North? I know the seniors program recently moved out of the building.
Yeah, so the question is there any we've talked a lot about East. Really, North has not been much on the radar screen as far as conversation is concerned. Is there discussions taking place? So the answer is yes, there's some discussion taking place. Still haven't figured out exactly what we want to do with North. With Acadia, the behavioral health hospital that recently opened, Jerry Psych, I think it was about 15 beds, if I'm not mistaken, maybe a little off there, but about 15 beds. They moved from Erlanger North to the Acadia facility. So that leaves a void at Erlanger North, and how might we position Erlanger North going forward? So I would open it up to you. What do you think Erlanger North should be? Is it more a long-term care facility? Is it an acute care hospital? Can it be turned into maybe a psychiatric need, not just Jerry Psych, but some psychiatric need where people need medical attention? Because Acadia is really, it's not an acute care hospital, it's behavioral health. And so where those patients need medical attention, like what we do for a living, those patients will go from Acadia over to here if we're not in their facility. So what do you think Erlanger North? How should we position Erlanger North? I'll just pose that to you as a question. We've had a number of ideas. Nothing is really stuck at this point. So I can't stand before you and say Erlanger North is going to be absolutely this in the upcoming 3 months. Some discussions are taking place, especially with Jerry Sock moving out. But those of you, some of you I see, I know you've been in the system a long time. Erlanger North has always been there, but we've never grown Erlanger North over my 29 years at Erlanger Health System. What do you think Erlanger North should be? What should they become?
There's an acute care site need for sure.
Acute care site, okay.
Maybe a pediatric autistic.
I'm sorry?
Maybe a pediatric autistic inpatient facility.
Pediatric autistic inpatient facility, okay. All right. What other thoughts do you have?
I know some of the staff over at North had brought up day surgery as something to bring back.
Okay. So day surgery, bring back day surgery.
I know that we've been involved in a lot of community education, trying to prevent readmissions and all that kind of chronic disease. Maybe a dedicated classroom for whatever type of community education that would help decrease the readmits and help patients managing their own diseases.
Okay, so the comment was we have a lot of focus on reducing readmissions. We've done a pretty good job, but we continue to have that focus. So, through education, could Erlanger North, not just for the entire facility, but position Erlanger North as an educational facility so people could come and it would assist in educating, patients and those family members taking care of those patients to mitigate and minimize readmissions and to assist in caring for those patients and helping them coordinate and facilitate what their needs may be. Okay, thank you. What other thoughts do you have?
I work with trauma services, and I've noticed that a lot of our harder to place patients for rehab end up going to Erlanger North, so maybe expanding as a rehab.
Okay, so the comment was we move patients from downtown to Erlanger North if they have rehab services, and so reposition them to open up a bed downstairs, so we move them to Erlanger North. So can Erlanger North be more focused around a rehab facility? All of these are good ideas. I don't know which one may stick and where we might go with it, so thank you for your thoughts.
I work on that side, and a lot of our patients don't like to come over the river.
Yeah.
So specialties, a lot of specialties.
To rotate specialties through, grow it from a specialties perspective. Okay. All right. Yes, ma'am. I'm sorry. Okay. So the comment was grow the ER, have more presence from an emergency department perspective to kind of decant and or be a release valve for the downtown emergency department. Any other thoughts? Good question, and thank you for your thoughts. Okay, and some of what you suggested is being discussed. Not all of it is, and maybe most of it hasn't necessarily come onto the radar screen and involved in the discussions. But I appreciate your thoughts. So I'll go back and I'll mention to the individuals involved in kind of helping shape what Erlanger North is going to be for us in the future. I'll mention your comments. So thank you. Thank you. Question? Now I can't stand before you and say I can answer every question. I'm not smart enough, but anyway, let's see what I can do.
Well, it seems like there's so many needs. Wonder if there could be a way that Erlanger North could be set up with a team to do those, to try all that, they could be the Erlanger that tries the new things and gets it out there and they can do the numbers and they could be the setup for have a team set up to say, hey, we're going to try this time. Let's see how this works. This looks good. Just a lot of times paper doesn't tell everything.
Yeah. So comment was paper doesn't tell everything. You can do all kind of analytics, but sometimes it can lead you in the wrong direction if you're not careful. But what can we, if I understand the comment correctly, so can Erlanger North become a little bit of, and I'm going to refer to it as an innovation hub. So thoughts we have, kind of new visioning, can we trial and pilot certain programs at Erlanger North, see if it's successful, see if it works. Maybe they're permanently placed at Erlanger North, but they may be created to see if there's a marketplace for it, and then it may be repositioned elsewhere in the enterprise. So have a little bit, and I don't know if I'm interpreted your, yeah, so. All right, so he's saying guinea pig. Use Erlanger North to be the facility that is our guinea pig, and we dream, we think of, have innovative thoughts, and see if we can pilot those programs at Erlanger North.
Well, not to swamp those, having a team set up to, be the not just throw, hey guys, try this out. Just have a team that goes with that.
Yeah. Yeah. So he's saying resource the idea also. Don't give the resource to somebody who is already overbooked, overworked, and say, do this also. So resource it. That's a good point. Any other comments or questions?
My group from downtown here, they're asking what we might be doing with parking. I know it's something that we're kind of touching on each week, but
Yeah.
there are some concerns.
Okay, so the comment was there's concern about what we may be doing with parking. And now that's one I don't know that I can stand before you and tell you all the detail around it. Yes, parking has changed over the last 2 or 3 years. Yes, we've struggled with parking. Yes, our patients struggle with sometimes finding a place to park. So there are changes coming, and I don't know how much communication may or may not have gone out. So yes, there is changes upon us, and I'm not going to say it's going to be for the convenience of everyone. So I would love to stand before you and say it's absolutely for your convenience, but I hope we have in mind whatever we're doing, it is for the patients and it's for the people that we serve. And we, as the associates, could be inconvenienced so that we have the proper parking for the individuals that we are serving. I don't know how much inconvenience there may be, but I would imagine if you're parking, a quarter of a block from the building and now you're going to have to park a block away from the building, to me you've been inconvenienced. I'm not saying you can't accommodate that, but there is. So my level of inconvenience is, you can kind of see what the definition may be. I don't know all the particulars about it, so I can't speak to the particulars, but yes, it's supposed to be well communicated, and individuals fully understand where they're supposed to park, how they're going to be parked, how it's going to be monitored, and so forth. So that's a good question. And sometimes we can sit, you do, and you can have dialogue and you can have discussion, and you're thinking about this Chattanooga plus 100 miles in the landscape, and do we need to buy Hospital A or Hospital B? And sometimes you may say the simple things like parking that need to be the most important. So I stand before you and I do acknowledge and recognize parking is hugely important to the 7,000 plus associates that we have. So I'm actually glad that you lifted that up. Yes, ma'am.
I was just curious.
Now, Patrick, I may be out of time, so you say, last question.
I was just curious what the plan is with the HR building.
So the plan with the HR building, so human resources, accounting, so there's a few departments moving out on Nicola. Hopefully, I know it will benefit those departments. Hopefully, over the long term, it will benefit the organization. More than likely, what's going to happen to the HR building, it will be demolished. It will be bulldozed. Now, that's not going to happen next week, but the building is really outdated, outused, and some new structure will go up on that side of the street. So if you look at kind of the revisioning of 3rd Street, you got Children's Outpatient Center, we've got to have Children's Hospital, a new tower, maybe a neurosciences building, whether it's in current Children's building and or across the street around the Human Resources. So there's a number of ideas, but I would say all of the ideas include bulldozing that building. So, there's probably 30 or 40% of the building that's not used now. It's kind of shuttered. Well, now, the credit union, they own their building. So when I say, I'm talking about the Human Resources building. The credit union building is a separate building. We will continue to have discussions with the credit union. We will want to accommodate what needs they have. Will they want to keep the current structure? Might they say, if you're going to build something nice and new, we need storefront. We need to be first level. Is there a place that we can lease? So those discussions, I'm not aware that those discussions have been finalized. They've been underway for multiple years. I know about 2 years ago I was in some discussions with credit union leadership. So there is discussions with them. I don't know what the most recent discussion might have yielded. But we will have to, take that into consideration. They own that property, so they could say they want the building, and so that we would have to honor that.
I was wondering what the plans are, if any, for continuing to invest in the current workforce to help it help us to stay current in our field.
Okay, so above a couple of things. So one is each department has professional education dollars budgeted. I would say that probably falls short of doing exactly what you want, and it becomes part of your expense, my expense to educate myself, and also the organization funds part of that. We have a tuition reimbursement program. Last year, between tuition reimbursement, professional education, don't hold me to this number, but I believe we spent about $2 to $2.5 million. So that's kind of ballparking. I do not, human resources and the organizational department, so Patrick can probably better address it from a human resources perspective, a human resources department perspective, exactly what will be done. I know they want to provide more education to our employees, to managers and so forth. I don't know what necessarily he may be able to address specifically what's on the books. From a professional ed, and that's part of the budget, you know, whether it's $1 million, $1.5 million, or whatever the dollars are across the organization, that is your manager would have the responsibility of allocating that in an appropriate manner to the employees within that department. And departments don't have a strict guideline, you know, that this is how you allocate the money, this is how you will disperse those dollars to the employees. The managers would have some flexibility in determining what the needs are and what's the most effective way to spend that money. I don't know that I'm really tackling it the way that you want or addressing it, so, but it is something that I think we need to continue to give additional focus to. I do. So let me, that works. All right? If not any other questions, Patrick's getting nervous. He's walking back and forth. He's ready to say, Greg, time to move on. Next agenda item. And what I'd say, thank you for your input around Erlanger North. As I always say, thank you for being a SEAL and your dedication to Erlanger Health System, and more importantly, dedication to those that we serve. And always remember, well, let me ask you, what is our mission?
Passionately care for people.
We compassionately care for people. Don't you like a simple, straightforward mission versus 2 paragraphs? It is so powerful. And you repeated it. A year ago, we couldn't do that with each other, but we compassionately care for people. Just as I said the last meeting, make it come alive at an individual, department, division, and organizational level. You need to be, we need to hold ourselves accountable, let me say that, not just you, but we, in living out that statement. We compassionately care for people. Thank you for what you do for the organization and our patients. Everybody have a great day.
Thank you very much, Greg. It's always great to get those organizational updates directly from that executive level and get that level of detail. I'm going to turn it over to Kayla Crook, Benefits Analyst in Human Resources. She's going to tell us a little bit about the Thrive program and the upcoming health fairs. Yep.
Mic work?
Yep.
No. Good afternoon, everyone. You guys had great questions. You've got my brain kind of turning, so I apologize if I'm a little bit all over the place. But did everybody grab one of these when they walked in? If you didn't, grab one when you leave. Thank you. So I am just here. My name is Kayla. Sorry I didn't introduce myself. I do work in the HR department, in the benefits department specifically, but have the pleasure of being on the Thrive Committee. And I've spoke with you a little bit about it before, but we have our upcoming Thrive Health Fairs this October. We will have one at each of the 3 locations here in Chattanooga, so Baroness, East, and North. How many of you guys came last year? Anybody come to the health fairs last year? Anybody? All 4 of you? Well, come this year. So that's been one of our biggest struggles, is advertising, making sure that you know when it is, what it is, where it is, and can come and participate. So it is all day. It's 7 a.m. to 4 p.m., so we try to address as many shifts as possible. You know, a lot of people are getting off early in the mornings or just coming in early in the mornings or are coming in the afternoon. So the dates are on here. Erlanger East is the first one, October the 3rd. Again, 7 a.m. to 4 p.m. Erlanger North will be the following week on the 10th. And then the last one will be here at the Baroness campus on October the 17th. So last year we had some really great feedback from these events. So we just really want everyone to know that it's going on and have the opportunity to come join. So a little bit about Thrive. We have broken it down into 5 pillars of health. We have physical, community, financial, social, and purpose. So all of the vendors that come to our health fairs, we try to pick out ones that fall into one of those categories. But we will also have, which this isn't necessarily a pillar of health, but we will also have our benefit vendors there as well. So that will be right before open enrollment. I think open enrollment is right at the end of October, early November. So most, if not all, of our benefit vendors will be there, so you can ask questions and things like that right before open enrollment is here, so that when you get ready to enroll in your benefits, you'll have a little bit better understanding of the products that we offer. So some of the vendors that are coming, we have several different gyms. Last year, a lot of them offered discounts. A lot of them give giveaways, free goodies. I heard somebody say earlier, free swag. I love it. So you're going to get free stuff. It's free of charge to come. It is specifically for Erlanger employees. We will have some financial institutions So last year after our health fairs, we did a survey. I don't know if any of you got to participate in it, but we just flat out asked, of these 5 categories, which are you most interested in? No surprise, physical was number 1, but number 2, which was a bit of a surprise to me, was financial, and it was very close to the physical portion. So a lot of you, it's a very sensitive topic, but a lot of you are interested in financial health and financial well-being. And so we've been trying to offer some classes for that as well. But we have partnered with some financial institutions that are not trying to just sell you a product like they used to do, or get you to open a checking account or whatever it may be. They truly want to come in and educate you on budgeting, retirement, planning for your future, planning for your kids' future if you've got college funds and things like that. So we've got some classes coming, but they will be at the health fairs as well. We have several nonprofits that are a piece of our community. So if you love Chattanooga like I do, and you want to get involved, and or you just want to know what's going on, events, we do have several nonprofit and community vendors coming as well. It's a lot of fun. It's upbeat. A lot of the vendors have giveaways, free stuff. We on the Thrive Committee actually have some giveaways as well, but they will be prizes. So last year we had a table set up. You come in as an Erlanger employee, we scan your badges, kind of like the flu shot, but a lot more fun than the flu shot. And it enters you into a drawing. And so after all 3 health fairs are complete, we'll do a drawing and fun stuff. There were gift cards, like Yeti mugs, all kinds of fun stuff. So some of them were, our vendors had given away free memberships to gyms, free personal training. That stuff is expensive. So to get free stuff is really awesome. So please, please, please go back to your departments and tell your colleagues about it. Again, this is one of our biggest struggles, is just simply communicating. We'll have these posters up around all of the campuses. Lovely Taylor will be sending out an email as well, but I know a lot of you, especially clinical staff, don't have a need to check your email very often. So you may miss out on a lot of opportunities because of that. So please share it. Take one of these, post it in your break rooms. You know, I post these around campus, but I don't come directly into your department break rooms. Probably can't get into half of them anyways, but, you know, post these if you've got cork boards, wherever it may be, bathroom stalls, I don't care. Post it wherever you can so that all of your colleagues know about it. Talk about it. Whichever campus you work out, you know, figure out the date and just share it. It's a lot of fun. Again, free stuff. So just take these back. If you have any questions, you're welcome to email me directly. We also have a Thrive inbox. It's just thrive@erlanger.org. So it's really easy to remember. But if you've got any questions, concerns, ideas, anything, please reach out to me and let me know. Any questions? Make sure you grab these if you haven't already. And if there's extras out there when you leave and you've got a large department with several break rooms or whatnot, you're welcome to grab multiples and post them around your areas. Thank you.
Thank you very much, Kayla. And then up next, we have our Chief Diversity Officer, Elizabeth Apley, coming up to speak with us on the broader topic of cultural sensitivity, but specifically on access to language interpreters here. So,
While Victoria's setting up, I'm going to bring in the presentation, the PowerPoint up. I'm going to tell you a little story. Something that just happened recently. I'm glad that we were on tap to come talk to you because we were really going to talk about cultural sensitivity today. But we were called or visited by an advocacy group that had some concerns that we were not providing and interpreters at a reasonable time for our patients. And I know that's not true, but that is the claim, guys. How many of you know how to request an interpreter? How many of you knew we had a language services program? Wonderful. And how many, if we have a deaf and hard of hearing interpreter, a deaf and hard of hearing patient at our facility, do you know what number do you call, or who do you call? Who do you call? Ghostbusters, or who do you call? HealthLink, yes, thank you. Spanish interpreters. We need to bring prizes for you guys. This is wonderful. Let me tell you about the Disability Rights of Tennessee is an advocacy group that is looking to file lawsuits. And they like to file them for the deaf and hard of hearing. If there's a deaf and hard of hearing patient that comes to your facility and they do not request the interpreter, we still want you to request an interpreter. If there's a family member with that patient and the patient is insisting on having the family member interpret for that patient, would you let the family member interpret? How would you handle that situation? Anybody want to jump in there? I know Joy knows. Do what? Still get an interpreter. Yes, ma'am. Please request an interpreter for patients that cannot speak English. Limited English proficient patients. There is a language services policy on the administrative policy and procedure website on the intranet, and it gives you all the guidelines. We just handed out a booklet for you, and you're going to be my communication line. That's what I was told. This group will get the word out. So this is what I'm expecting of you guys. When DRT called, just to give you another little background, they claim that your staff doesn't know how to request interpreters. They have no clue. The VRI, the Video Remote Interpreter laptop, they don't know how to use it. It's not ready when the patient is in the room and being seen by the physician. They don't know what to do after hours and on weekends. Providing deaf patients and families with effective communication, they're not doing this well. Are you training your employees? And we're always training our employees. We train all our new employees at new employee orientation. So this group is a great group to get the word back to your staff. We also gave you an acknowledgement agreement, and these are some of the things that we will gather, because we've already talked to the clinical effectiveness nursing group. We've done our rounds at all the departments, mainly the clinical staffs. We're still doing in-services at all of our clinical floors at their staff meetings. So if you have a staff meeting, you'd like for us to come to your staff meeting and train your employees, we'll be glad to schedule those. Victoria will be glad to schedule those. So today we're just going to talk about the in-service. We're going to cover Erlanger's Language Services Program, and we're going to talk about American Sign Language interpreters, the VRI, Spanish interpreters, in-person, telephone-based interpreters. You're going to know how to do all this when you leave, and the video remote interpreting system. Okay, we're just going to go through this real quick because I know we have 15 minutes and everybody's ready to get out of here. So everybody knows exactly what I do around here, don't you? Just about everything. A little bit of this, a little bit of that. But the Language Services Program is what we're going to talk about today. Greg talked a little bit about the new buildings going up. So, the Supply Diversity Program is really big on our radar also. And making sure that all minorities and vendors have a part in that, getting some contracts and signing vendors up and get work out in the community. We have our educational and community involvement. But let's get right to the program. Face-to-face interpreters, American Sign Language interpreters. We have 2 contract agencies. Partnership for Family Services is one of those agencies. Language Services Associates is our second contract agency. When you are requesting a deaf and hard of hearing interpreter, you'll call HealthLink, like you stated. Spanish interpreters, we have the Spanish interpreters on site. Technology, we have the VRIs, the language lines. How many of you seen the language phones? 2 handset language phones. Tracking real data, that's what Victoria does. She tracks our data to see if we need to increase our interpreters services, and it looks like we're going, with all the new buildings and all the new facilities and new physician offices, we probably will be increasing our services. Spanish competency assessment exam. You heard that we have the medical interpretation courses. Is anyone in the room taking those Spanish courses yet? No? Those classes are coming up soon. We have one on the 26th of September, is that right, Victoria? And the 27th, part 1 and part 2. So if you're bilingual in Spanish, we need you to sign up. So Erlanger's policy and the government, Joint Commission, DMV, states that Erlanger Health System, any system that receives Medicare, Medicaid, federally funded organizations must provide services to their patients during their delivery of all significant healthcare services, free of charge, and make within a reasonable time and a reasonable accommodation. So if we had a patient that was in our facility that requested an interpreter for 24 hours a day, 5 days a week, is that a reasonable accommodation? No, that is not a reasonable accommodation. Have we had those requests? Yes, we have. Have we had patients that ask to have someone in their room all the time? Now, there may be a time that we might need to provide that service, and we'll have to have more than one interpreter, take those requests, of course. That's if a patient has that need, and who will make that assessment will be the physician and the nurse. So I depend on the clinical staff to help me make those determinations. We've had a patient that was deaf and blind in our facility several times. So yes, we have had to provide longer services for them and make those accommodations. So anytime a patient has limited English proficiency, patient speaks some English, but not fully fluent. If a patient's sitting in front of you and they're nodding their head or just signing off on paperwork and just looking like they're in a little daze, they probably don't understand what you're saying. So even if they speak Swahili, speak Russian, Mandarin, you can use a language line phone. We don't have in-person interpreters on staff for those languages, but we have the tools to take care of those services. So you can call up on the phones, request an interpreter for that language, and they will interpret for that patient at that time. This is 24 hours a day for the language line, 24 hours a day for the VRI. We tried to make it a little simpler for you on showing you how to request interpreters by creating an algorithm, and that's in your booklet also. The VRI laptop, if you look in the top right-hand corner, you'll see how the laptop looks. There's instructions on the laptop on how to enter the service. It's very simple. And what we ask you to do, when you bring the laptop up, bring it up at the system the software that you can request an interpreter. Bring the interpreter up at the front desk on the laptop. And then take the laptop in the room to the patient with the interpreter on the screen. Because some of our patients, and I'm sorry, software that I don't use every day, I'm going to fumble with it. If I don't use this software every day, if I have to enter a password, I may enter it wrong, 3 tries is locking you out, those type things. We're human. But our patients watch us very closely, and they don't know what they're doing. I need I'm sure when you're sick, you're not feeling well. Because I know I'm so happy when I'm not feeling well. I'm not angry at all, guys. That's not true. But we do get a little irritable, don't we, when we're not feeling well. So I'm sure that's what's going on with our patients. So let's try to be really mindful of that and just bring the interpreters up on the screen. I'm sorry. Okay. It's off, but it's not going off. But anyway, follow those instructions on the passwords. And if you need any more instructions or any time for us to come and do in-services on helping you log into the VRI, we will come up to the room and do that for you. If there's not a VRI available in your area, we have assigned VRIs to the emergency rooms, children's emergency room, the main emergency room. Where else, Victoria? Dispatch. I told her she was going to assist me with this PowerPoint, and she sat down, guys. And just about every floor has a laptop. If you don't have one, you can request one from dispatch by calling 7614. You'll have to leave some blood, leave one of your children, sign out, No. But make sure you sign the laptop out, and when you finish with it, you can take it back because a lot of times someone else wants to use it. We have found one of the laptops in the laundry basket, guys, so help us out to keep track of the laptops. And as I said, they were available 24/7, and they can be left with the patient if the patient is deaf and hard of hearing. This is really important, and this is one of the things that one of the patients reported. If you have a deaf and hard of hearing patient on your floor, and the patient, you know the patient is going to be there for 4 or 5 days, and you can request an in-person interpreter, of course, but after hours you may need the laptop. It's okay to keep that laptop on that floor and use it with the patient. I'm not saying leave it in the room with the patient and teach the patient how to log in. No. We need the staff to log in and bring the interpreter up. And this is the VRI locations. Security dispatch, the EDs and OBs, nurse supervisors' offices on North Campus and East Campus, and even Sequatchie and Bledsoe has been assigned a VRI. And this is how our language services tools look. We have the double handset phones. These are our older ones, but a lot of people like to use the older ones. We've found that the dual handset cordless phones work a lot better, and they're a lot more convenient for our staff and patients to use. The laptop again, and make sure there's a speaker attached to your laptop when you're using it. It throws the volume out a lot better, and the patient is a lot more happier when they can hear the doctor and the interpreter. Now, of course, there's always laws, of course, just like the Disability Rights of Tennessee. We have Title VI laws. Those are federal laws, and we're federally funded, and we talked about that when we receive federal funds. And also, that's a disability, the ADA. We have to be in compliance with ADA requirements. Disabilities include an impairment of one or more major life functions, which is mobility, visual, hearing, mental, or major bodily functions. Family members. Please be very careful about family members. We have had lawsuits where our patients claim that instead of our staff requesting an interpreter, which I know this didn't happen, did it, guys? They used a family member. They even asked a family member to interpret. So when we investigated it, we found out that we did request interpreters for this family, and our staff actually really documented very well. Documentation, again, is very important. And Epic is really, they have some hard stops in there where you have to put in the system if you need an interpreter or not. So make sure that we do not use family members to interpret for our patients. Even in children's hospital, we've had some cases where maybe a 16-year-old came in with a 14-year-old, and they wanted to interpret for them. No, we cannot use family members, especially underage family members. So don't use family members to interpret for patients at any time. Now, if there was a patient that came in, there's an emergency, and the patient, the family member is interpreting until you bring in the VRI, until you bring in the interpreter, just for that moment, and have them reiterate what was said to the patient before the interpreter got there, so that you can document that an interpreter was there during that session, and they did have a session with the physician and the nurse. And this is all on family members, and we've talked about that. There's also one other thing I need to bring up. We have created a waiver. So, like I said, there may be some family members that may insist on interpreting for a patient. We've created a waiver, and we've had our Jeff Woodard looked at it, and some of our staff looked at it, and we've gotten it approved through our legal department. And the waiver states that you have to put in the information that the patient is insisting. So guess what you have to do? If this is a Spanish patient, and you will have to still request an interpreter to interpret the waiver. So why not request an interpreter? But If they insist, request an interpreter to read the waiver to the patient in their native language and have them sign it and date it. And then it's to be witnessed by our staff, our clinical staff. And we have trained interpreters on staff. I know we're getting late. And this is your responsibilities. And that is on the sheet that we handed out to you also. We want you to make sure you ask the patients if they need any interpretation or accommodations. We want you to make sure you provide a reasonable accommodation during patient care. Know how to request interpretation services at Erlanger Health System. Do not use family members. Google. Like some of you probably said, uh-oh, Google. Nobody's used Google, right? Or co-workers that are not deemed competent for interpretation. Don't pull the housekeeper or the dietary person and bring them in because they speak Spanish. Please do not do that. And document in Epic the interpreter's name and number. When you use the language phone and the VRI, they will give you an operator number. Please log that operator number or the interpreter's name in the system. Provide an interpreter during patient discharge. If the patient's being discharged, please have an interpreter there that speaks Spanish, that speaks Swahili, that speaks Russian, whatever that language is that patient is requesting, in their native language, please. We won't go through that. We kind of give you the top 5 languages that we've looked at that we get most requests for right now, and we'll give you the Spanish is number 1, of course. It stays at number 1. Arabic is number 2. 3 is ASL, which is deaf and hard of hearing. 4 is Vietnamese. 5 is Swahili. Vanderbilt has so many requests for Arabic. They've hired Arabic interpreters in Nashville. So I can see us probably hiring an Arabic interpreter in the next 2 or 3 years. So does anybody have any questions before we tie this up? Is there any questions at all for me or Victoria? Okay.
I work at a physician practice in Hickson.
Mm-hmm. Yeah, that's, okay. Yes. And didn't we hook up phones in your area, language phones? Can you get with her then? Okay, so you don't have any type of tools or anything? Okay, and you have never heard of this program yet? Okay. All right, then, that's not good, but thank you for being here today. We will take care of you tomorrow, as a matter of fact. So you do know now that if you have a Spanish patient that comes to the hospital, you need to request an interpreter.
Well, I work in the physician practices, so.
Right.
Most of the time we have a schedule, but we do have acute care too. So.
Mm-hmm.
I mean, even on the schedule ones, we don't have any we didn't know.
That is even better. If that patient is scheduled, that's perfect. If you could just, as soon as you schedule that patient and you know they don't speak English, let us help you get an interpreter for that appointment. Okay?
But as far as the walk-in clinic, we'll be able to get another two-way.
We'll get a phone to you tomorrow. Okay. Thank you. And share the information with your staff, and we'll send over more information for you. We'll actually email it so you can give everybody a copy of it. All right. Anybody else? Well, this is awesome, guys. This is perfect to be able to capture you all. If you will sign the forms that Victoria handed out to you and hand those back to her, you just pass them back down to your left or right. We'll come by and pick those up. That we did train the most proficient, best communicators at Erlanger Health System, and they will get this information back to their staff. Thank you very much. Y'all have a good day and a good weekend. Okay. You can just put them in the box right here. Thank you. Also, I just want to share a real quick
So